It must be frustrating for you as a scientist to look at the numbers that are actually proving your theory, and yet the media and the governments present this one number every day, total cases, and we're going to get into this, and total deaths, but we don't look into who are those deaths, what are the circumstances, what's happening. And when we see that number, we think it's our kids, our brothers, our sisters, when it's actually a different part of the population. Is that right?
Yeah, and to look at the cases are not very informative because that depends so much on testing. So if we increase testing, the cases are going to increase. If we decrease testing, it's going to decrease. So hospitalization is, of course, an important metric, and mortality is an important metric. But the ultimate metric is actually all-cause mortality and comparing it to previous years. And I don't know the statistics for the UK, but if we look at the United States, the last time I checked, there was over 230,000 COVID deaths in the United States, which is hugely tragic. And a lot of those are the consequence of the misguided lockdown strategies and not protecting the elderly properly. But if we compare the mortality in the US compared to previous years, there is, in addition to that, another almost 100,000 additional excess deaths. So for cardiovascular disease, for example. And we don't know exactly how they divide between cardiovascular versus mental issues versus diabetes, for example. But we know what the total is. And we can compare that to Sweden, which was being closest to a more traditional public health strategy. They haven't done a perfect job, and especially in Stockholm, they failed to protect the nursing home residents during the spring. But Sweden has a little over 6,000 COVID deaths now.
And what did Sweden do? For people that don't know, what did they do or did not do specifically?
So for Sweden has about 6,000 excess COVID deaths, but the number of excess deaths compared to the previous 5 years is just below 2,000.
Okay.
So US has sort of a more excess deaths than COVID deaths, but Sweden have less excess deaths than COVID deaths. So that is a hugely important statistic.
Okay. Yeah.
To evaluate different approaches. So what Sweden did, it tried to protect the elderly. It didn't succeed completely, and especially not in Stockholm in the beginning. But it also kept, as the only major Western country, it kept schools open throughout the height of the pandemic. And education is critically important for children, not only for the education, but also for physical health, mental health, and social development, interacting with friends. So if we look at Sweden, schools and daycare were open from age 1 to age 15 throughout the height of the pandemic. And there are 1.8 million children in Sweden for this age group. And during this time, the number of children among these 1.8 million who died of COVID was exactly 0. And there were only a handful of hospitalizations. So this is not a serious disease for children and is much less risky than the annual flu, which in the United States will kill typically between 200 and 1,000 children every year, depending on how severity of the influenza season. Also, if we looked at Sweden, the teachers were not at higher risk than the average of other professions. So and we know from, for example, in a genetic study in Iceland that while adults can't transmit the disease, infect children, it's less common for children to infect adults. So there's absolutely no public health reason to not have the children in school, in person, full time, while there are many public health reasons of the damage that's caused by not having them in school.
Right.
So that's one example. And Sweden didn't close restaurants. They had precautions of more spacing between the visitors and so on, but they didn't close restaurants, etc.